In my unit, we went over protective equipment and off-the-field evaluation. First, I'll go over protective equipment. The concern for protective equipment should always be the protective ability over its appearance. The protective ability is determined by the National Operating Committee of Standards for Athletic Equipment. They kind of have the power and say so over what works and what doesn't. They are a very reliable source for this type of stuff. With this, we went on to specific aspects of athletic equipment. We went on to helmet fitting and how to do so. You want to make sure that there's a snug fit on the helmet. You can ensure this with the credit card test. You want to make sure there's no lateral rocking in the helmet, and just make sure it's snug but doesn't cause any issues. We went on to discuss off-the-shelf equipment versus customized equipment. Off-the-shelf equipment you can use instantly, but you may have an issue with sizing. But customized equipment is specifically sized and designed for supportive needs directly. We also talked about shoulder pad fitting, making sure that it covers the tip of your shoulder, making sure the athlete can raise their arms without the pads moving, and making sure it causes no issues with like tissue restriction or anything like that. We also talked about how ATs can produce their own equipment. They can use things like felt, foam, or heat molding plastics. We went over knee braces, talking about how prophylactic prevents injury and how rehabilitative knee braces follow surgery and they have an adjustable immobilization. We then went on to talk about off-the-field evaluations. These require a knowledge of the AT for knowing things like anatomy, biomechanics, and just having a knowledge of the sport or activity in general. We then learned about about hops, the tool for all of the evaluations that we use, and the steps that we use to take them. Starts out with history, and this is where the patient tells their story of what happened. You just want to listen to that and see if they can tell you anything about how it happened, where it happened, things like that. You then go on to observation. You find out what you can notice, see if you can directly see anything wrong with the patient. You then go on to palpation. You compare bilaterally, and you compare just what is going on with that injured part. You then have special tests that detects the ability to perform specific and certain movements. We then went on to talk about how there are resources that are available through your physician. You can do imaging, specific testing like lab works or breathing assessments. And so these are things that you would refer further to a physician. And then we also just learned about the importance of keeping a complete and accurate documentation throughout the injury. This helps to send your patients further on to a physician or wherever they might go. This helps to make this transition more seamless.